People who are hospitalised for less serious side effects after getting a COVID-19 vaccine can also apply for a $2,000 payout from tomorrow. Other updates from the Health Ministry include an easing of rules to allow more groups to be vaccinated. So women who are breastfeeding and cancer patients can also get their jabs. Cheryl Goh tells us more.
The $2,000 one-time payout is for patients who are hospitalised after getting their COVID-19 jab and eventually recover. It's on top of the other two tiers announced earlier for patients with more severe needs, such as intensive care or permanent disability. The Health Ministry said these payouts are meant to provide an additional layer of financial support on top of existing subsidies. This comes as the ministry updated its vaccine guidelines. People with multiple allergies can now get their COVID-19 shots as long as they do not have a history of anaphylaxis or severe life-threatening reactions to any drugs, food or triggers. Among the updates, people with active cancer may also get their shots. This is provided they haven't had any treatments 3 months before their vaccinations and no planned treatments in the next 2 months. Those who are in remission or on active cancer hormonal therapy can also receive the jab.
Cancer patients are more vulnerable. They are more likely to pick up the infection if they come into contact with the virus, and they have a much higher complication rate and mortality rate.
There are patients who are currently not eligible to receive vaccination because of ongoing treatment, and we will ask that you wait first while we monitor the safety data and effectiveness data that emerge so that we are able to plan for vaccination appropriately.
Breastfeeding mums have also been given the all clear, but they have been advised to stop breastfeeding for 5 to 7 days after receiving the vaccine. This is a precaution in the event of complications.
In about 48 hours or so, an immune response is created so that antibodies are formed. And the good news is that these antibodies can go to the breast milk to the baby to protect the baby as well.
Dr. Chong advised mums to plan their milk supply to tide over the period when they can't directly breastfeed.